So now, Ankita, this is the first rapid coronavirus test that can be run from start to finish at home. There were a handful of other tests that had been given that emergency authorization. You could collect the sample at home, but then you would have to send it out to a lab to be processed.
That's correct. So this is definitely a step in the right direction. And we think a lot about patients who may be staying home for a lot of different reasons, right? Because they are either responsible for caring for others that are in their home, or they cannot leave the home because they're frail, they're elderly. So this is definitely a promising move for a lot of us that have been asking for testing availability.
Now, is this something you self-prescribing to someone?
Absolutely, and I think that's where the key point that you're making is that right now this test, and as it should be, is a prescribed test, meaning that you speak to a physician or a clinician who understands what's going on, evaluates your symptoms, feels this is the right test for you in this situation. And the reason I say that is because, as we've learned from every rapid test, there's a concern about accuracy of the test. So we want to make sure that the result that we're getting is true result and not a false result. So I think that's very important that you keep open communication if you use this testing at home with the clinician who's prescribing the test.
Well, I think that's the big question is, do these tests sacrifice accuracy for convenience?
Right. And I think that's a really important question to ask, because just as, if I was to send somebody for an x-ray of the chest because I think they have pneumonia, I'm going to want to know how accurate is that x-ray. Similarly, with the rapid tests, there is a concern when it says that you do not have COVID-19, but you have symptoms that sound like COVID-19. We would do a follow-up test, which is the traditional gold standard PCR, the test that takes a couple of days to come back to make sure you do not have COVID-19. And that is an important step in doing this home kits.
So the